Welcome, future nurses. I am so incredibly excited to guide you through this explainer today. We are doing a deep dive into an absolutely critical topic, primary healthcare. We're going to actively shift our mindset from the traditional acute hospital setting and move out into the community. Because the truth is, that is exactly where the future of nursing is thriving. Let's get right into it. Here is our roadmap for today's session. First, defining primary healthcare. 2, PHC in the U.S. healthcare system. 3, the vital role of nurses. 4, real-world PHC nursing. And 5, we'll wrap up with some high-yield NCLEX and interview prep. All right, Section 1, defining primary healthcare. So when we say primary healthcare, we're not just talking about treating a sore throat at a local clinic. It is way bigger than that. According to the World Health Organization, it's a fundamental whole-of-society approach. It is deeply rooted in human rights and the social determinants of health. It's all about empowering individuals and communities across the entire continuum of care. We're talking everything from health promotion and disease prevention, all the way to rehabilitation and palliative care. Now, to clear up a really common student misconception, let's look at these two terms side by side. People often use them interchangeably, but they are absolutely different. Primary care is the clinical process. It's the actual promotive and curative service that happens between a provider and a patient. But primary health care, that is the overarching, broader strategy. It encompasses that clinical primary care, sure, but it adds in essential multi-sectoral policy and community empowerment. It's the whole shebang. And this shift is exactly why your nursing curriculum looks the way it does. The American Association of Colleges of Nursing, the AACN, is actively moving nursing education away from just focusing on hospital beds. Instead, you're trained across these 4 spheres of care. These 4 spheres perfectly map out the entire primary healthcare continuum across a patient's lifespan. It ensures you're ready to manage population health, not just react to an episodic illness. Moving right along, Section 2, PHC in U.S. healthcare. Get a load of this statistic, 60%. Right now, a whopping 60% of adults in the U.S. are living with at least one chronic disease, and 40% have 2 or more. This staggering number proves that episodic hospital care, just waiting for someone to get so sick they crash and need an ER, is totally insufficient. We urgently need proactive, community-based primary health care to manage these conditions way before they escalate. And we all know chronic diseases don't just happen in a vacuum. By shifting our focus to robust primary health care, nurses help patients tackle massive systemic barriers head-on. We're talking about rural provider deserts, lack of insurance, zero transportation, and poor health literacy. When we address these social determinants of health directly at the community level, we literally extend life expectancy and drastically slash the massive healthcare costs burdening the U.S. Which brings us to Section 3, the vital role of nurses. So, class, where do you fit into all of this? Well, to bridge theory to practice, nurses need structured, evidence-based tools. The 5 A's model is an incredible framework endorsed by the U.S. Preventative Services Task Force. Nurses use this daily to counsel patients on tobacco cessation, diet, and lifestyle changes. You assess, advise, agree, assist, and arrange. Notice that third step, agree. It highlights that modern nursing is a shared, collaborative partnership. We don't just give orders, we co-create health. And if you want to know the massive potential of your career trajectory, just look at this. Research proves that advanced practice nurses, specifically nurse practitioners, can safely and autonomously handle 80 to 90% of the care traditionally provided by primary care physicians. That is huge. APNs are literally the workforce solution to the primary care shortage, and they deliver equal, if not higher, patient satisfaction. Let's see what this looks like in action. Section 4, Real-World PHC Nursing. This beautifully illustrates the true front line of primary healthcare, providing essential preventive care, like routine immunizations, right where the community lives and breathes. But remember, this could just as easily be health coaching, chronic disease management, or maternal care. This is where real trust is built and where holistic, person-centered care actually happens. And the data totally backs up this approach. When nurses take the wheel and lead care coordination, we see phenomenal system outcomes. We're talking drastically improved patient satisfaction, increased treatment adherence, a 17% drop in system costs, and a brilliant 12% reduction in 30-day hospital readmissions. Simply put, when nurses coordinate care, patients stay healthier and they stay out of the hospital. All right, time to get you ready for the real world. Section 5. NCLEX and interview prep. Let's do a quick knowledge check to test your active recall. Based on the AACN's framework, in which sphere of care does the management of minor, acute, and intermittent care needs of generally healthy patients fall? Think back to those 4 spheres. Got your answer? The correct answer is the disease prevention and promotion of health and well-being sphere. The crucial takeaway here is that this sphere goes way beyond just wellness checks. It actively manages those minor, intermittent, acute issues for generally healthy folks before they snowball into chronic problems. Next up, let's hit a scenario based on the USPSTF 5A's model. A primary care nurse is assisting a patient with smoking cessation. Which step of the 5A's model involves collaboratively setting goals with the patient? If you said agree, which is step 3, you absolutely nailed it. Remember, effective primary healthcare is a partnership. If you and your patient don't actively agree on the goals, they are highly unlikely to stick to that behavioral change. For our final NCLEX revision question, think back to the very beginning of today's explainer. What is the defining difference between primary care and primary healthcare? This is a big one. Primary care is the specific clinical service, the actual stuff happening in the office or clinic. Primary health care is the whole, overarching, holistic, whole-of-society system that supports it, tackling policies and social determinants alongside that clinical care. Now, fast forward a bit. You've passed the NCLEX, huge congratulations, and you're sitting across from a hiring manager for a community health clinic. They might throw these at you. How do you envision your role in improving access and care coordination for underserved populations? Or describe how you would utilize an evidence-based model to address an unhealthy behavior. How are you going to answer? Well, consider this your cheat sheet. Use these talking points to absolutely wow them. Show your interviewer that you don't just understand basic clinical tasks, but that you grasp the systemic value of a nurse. Mention how your care coordination directly reduces hospital readmissions. Drop the 5A's model by name to prove your evidence-based reasoning. Emphasize shared decision-making. This shows you are a systems-level thinker ready to hit the ground running. I'm going to leave you with this mind-blowing fact. Globally scaling up primary healthcare interventions could save 60 million lives and boost average life expectancy by almost 4 years by 2030. That is just incredible. So here's my final provocative question for you. How will you take this knowledge, step out of the classroom, and use it to transform your patients' lives out there in the real world? Thank you so much for joining me on this explainer class. Keep studying hard, and I'll see you next time.